protein over here receives a stimulus, it is going to move over to this protein over here. This protein is called phospholipase C. And what phospholipase C is going to do, well, it's an enzyme. It's got the name ACE. There's some lipid terminology in there. It's going to break down a lipid. More specifically, it is going to break down, now let's see if I can remember how to say this, phosphatidylinositol 4,5-biphosphate. Now, phosphatidylinositol 4,5-biphosphate is going to break down into two things. And for the sake of everything and everyone's sanity in my English speaking skills, we are going to call this PIP2. Now, what PLC or phospholipase, it breaks down PIP2, it's going to break it down into two things. The first thing it's going to break it down into is ionositol triphosphate, or IP3. So we're going to say IP3 because I can't use words correctly. And it is going to break it down into diacylglycerol, or DAG, D-A-G. Now, what IP3 is going to do is it's going to come down here, and it is going to stimulate the ever-loving crap out of these calcium channels. Now, what the stimulation of these calcium channels in the sarcoplasmic reticulum is going to do is it's going to cause a lot of calcium to exit. So we'll see. Boom. We're going to have a lot of calcium out here. Ca2 plus, Ca2 plus, Ca2 plus. And what that excessive amount of calcium is going to do is it's going to be able to form a lot of these activated calmodulin complexes. So calcium is going to bind to these calmodulin complexes. Now, there's a lot of these calciums out here, so there's going to be a lot of calmodulin complexes that can be made. And what does this do? Well, it takes our myosin light chain kinase inactive form, and it combines, and it's going to become an active myosin light chain kinase enzyme. Now remember, what does this myosin light chain kinase enzyme do? Well, I am sure glad you asked. It's going to take some ATP. It's going to break it down into ADP plus P, and this phosphate over here, it's going to bind. And what is this going to do? Well, I am so glad that you asked. It's going to allow the muscle to actually contract. So we got some phosphate here. We got some phosphate here. Bam. It's going to contract. That is supposed to be an arrow. And if there was one over here, then it would contract in that way. This is how your smooth muscles contract, but this is the IP3 and DAG pathway.